Fertility is a deeply personal journey, yet many women are experiencing pressure around it earlier than ever before. Recent data show that more than 70% of Gen Z women report age-related fertility anxiety, some as young as 23 years, while nearly half feel pressured to have children before the age of 30 years. In this conversation, Dr. Natalia Llarena of HRC Fertility explores what's fueling this trend, how misinformation and outdated language such as geriatric pregnancy can worsen anxiety, and what proactive steps women and clinicians can take to better navigate fertility planning. To begin, Dr. Llarena highlighted recent trends in fertility beliefs, alongside how these ideas might influence women's reproductive decisions.
Our trends have discovered that women are feeling fertility pressure at very young ages. Our data showed that about 72% of Gen Z women were experiencing age-related fertility anxiety, and many of them as young as the age of 23, and that nearly half were feeling pressured to have children before the age of 30. I think, I think part of this is so fertility, I don't want anybody to be panicking, right? I mean, panic typically doesn't help with anything, but I think, you know, women feel pressure to find a partner earlier on, sometimes before they're ready, or sometimes, make changes in the way that their career trajectory is going in an effort to sort of combat the biological pressure and the fertility related anxiety.
Next, Dr. Llarena provided clinicians with the steps they can take to combat fertility panic among their patients.
Yeah, I think some of the panic is rooted in biological realities. And I hope some of this, although I hope it's not panic, I hope some of it is increased awareness about the impact of age on fertility, which is, I think, really important for women to be aware of. I still see far too many women, in their early 40s who haven't been well educated enough about the impact of age on fertility. So I hope that some of this is because the education is improving surrounding the impact of age. And there are certainly proactive steps that women can take to mitigate some of this worry and some of this biological pressure. I think one is to just start by living a healthy lifestyle, avoid smoking, avoid vaping, eating, sleeping as healthfully as a person can. Fertility preservation, I think, is a great step to consider. Both egg and embryo freezing are great options for women who are, at an age where they're starting to be concerned about the impact of age on fertility, but may not yet be ready to conceive, either because they lack a partner or because they are focused on other aspects of life at the moment.
HRC Fertility is also taking steps to address fertility panic. Dr. Llarena highlighted this work, including active promotion of information and moving away from the label of geriatric pregnancy.
We have been very active in promoting information about egg freezing to younger patients. We have one thing that we haven't talked about yet is that the label geriatric pregnancy has been something that has been floating around in the OBGYN world for a long time. And many women feel, I think, shamed by this and prefer not to use that terminology. So we've begun a campaign to avoid the label geriatric pregnancy because our data seem to indicate that this heightens anxiety for women and that it can undermine self-confidence during pregnancy.
To conclude the discussion, Dr. Llarena provided an overview of the discrepancies in how the impact of age on pregnancy outcomes differ between men and women.
I think the other thing to mention is that some of the data centers around the discrepancy between how male and females are considered in terms of, the impact of age. And that is rooted in some biological realities. It's true that men don't experience the same impact of fertility, of age on fertility. We do see some small changes in sperm counts in men, but it does not even approach the degree of decline that women tend to see with age. But it is worth noting that there are changes in the in pregnancy outcomes with advanced paternal age. We do tend to see increases in genetic abnormalities with increased paternal age, as well as increases in some autosomal dominant conditions. And there are health-related concerns, including increased autism rates associated with increase in male age. So I think it's important message that this is not just about female age, that it is about both male and female age, and the age of both parties are important considerations. And I think, at any age that a woman is considering pregnancy, our goal is always to help them meet their fertility goals, whether they are coming, at 40 or they're coming at 28. We certainly can help. Our ability to help is always more the younger you come. So I think that for patients who are in their later 20s or early 30s and they're beginning to consider family planning, even if you're not ready to take action at this point, it never hurts to meet with an REI to get some information and empower yourself with information so that you make sure that you can meet your fertility goals in the future.
Fertility planning doesn't have to be driven by fear. As Dr. Llarena reminds us, awareness is empowering when paired with the right information and support. From healthy lifestyle choices to egg or embryo freezing, there are proactive steps women can take to reduce anxiety and preserve future options. And while age plays a role for both men and women, open conversations with a fertility specialist can help individuals make informed choices at the right time for them. The ultimate goal is not panic, but confidence in meeting personal family building goals.